September is National Vascular Disease Awareness Month, a good time to learn about the health of our veins and arteries. And once such a vascular condition is peripheral vascular disease, or PVD. It's a disease that affects millions worldwide. In the U.S., more than 8 million people over the age of 40 have PVD, and more than 20% of people over the age of 80 have it. Here to tell us more about PVD is Corewell Health Vascular Surgeon Dr. Jake Nicholson. Thank you so much for being with us.
Yeah, thanks for having us. We really appreciate it.
Yeah, so first just talk about PVD and what it is.
So I think you did a pretty good job. So peripheral vascular disease really is, the way I think about it, is blockage or disease of, best way to describe it is calcium in the extremities. So a lot of people are more intuitive with their heart, so the same sort of thing where people have coronary artery disease can happen in the extremities.
What are the symptoms? What can people look out for? What should they be looking for, the early warning signs?
So most of our patients, we see them come in and they complain of weakness or cramping of their lower extremities when they're walking short or long distances. We term that claudication. That's really the first evidence of peripheral vascular disease. Other people have issues with numbness, coldness in their lower extremities, or even wounds that don't heal well, or not at all. So those are more severe cases.
Maybe talk about the treatment options for PVD?
Sure. So a lot of times we like to start with medical management or lifestyle changes for our less severe cases, our claudicants, which includes, number one, foremost, if you're smoking, we try to stop smoking, exercising, diet, changing the diet and eating a little bit better, and controlling, your comorbid conditions like high blood pressure or diabetes. For those who need surgery, as vascular surgeons, we can offer endovascular options or minimally invasive where we don't have to do incisions and we use balloons and stents to open up the arteries. Or, some patients actually require open surgery, which we are able to do too, which is creating bypass, new blood flow routes for those people who need it.
What are the best foods for vascular health?
So a lot of people don't like the answer when they ask this questions in the office. The only diet that has ever shown regression of vascular disease is a all-plant diet, which is very difficult to maintain even for us, people who are spouting this sort of information. But really, you really want to reduce your, sugar intake, you want to reduce your fats, your cholesterol intake, and a lot of that can be seen with something like a Mediterranean diet.
Yeah, and there's a chance for people to get a free vascular screening through Corewell Health. Talk more about that real quickly.
Yeah, so we're offering free screenings at our office. It's 4069 Lake Drive. Suite 312, so vascular and endovascular surgery, and then you can actually call us too at 616-391-VASC to schedule that free screening.
Thank you so much for being with us here, Dr. Nicholson. Important conversation.